I'm going to be honest, this is not my laptop, so I'm going to try to figure out how I'm doing this. I'm not really an Apple person. Share. Okay, I think I did something. Not quite sure what. Oh, okay. Okay, I think I did it. Okay, so welcome everybody. Thank you so much for coming. My name is Adri. I am going to be presenting on the effects of COVID-19 on music therapy as a field. And I'm just trying to get my own face out of the way. Okay. Can everybody hear me all right? Great. So this is my first time presenting at Passages. It's actually my first time going to Passages. So there's that. I'm very excited and really nervous, so here it goes. Okay. So a brief introduction, a little about me. My name is Adri. I'm a junior music therapy major and a vocal performance minor. I go to Anna Maria College. I currently serve on the NER-AMTAS board as the vice president of Anna Maria College. Last semester, I completed my pre-practicum virtually at the Holy Trinity Nursing and Rehabilitation Center in Worcester, Mass. And currently I'm completing my practicum at the Perkins School for the Blind in the lower school in Watertown, Mass. Okay, so before we begin, I have a little something prepared. I know that all of us probably aren't loving the fact that we're on Zoom yet again for Passages. I know that for me, while it's my first time attending, I know some of the seniors and even some of the other juniors have probably gone in person in the past, and this isn't ideal. And honestly, we're all just really busy nowadays with everything being hybrid, half the stuff being online, half the stuff being in person. So I have a little focusing, centering song for us to kind of take a breath and take a pause before we get into it. So if you'd like to join me in closing your eyes, please feel free, unless you're driving, in which case, please do not close your eyes. And we're just gonna begin. I feel my body here in this space. I take a deep breath and know I am safe. I feel my heartbeat steady and strong. I trust my heartbeat to carry me on. I feel my feelings, they're with me today. I think my feelings and know they're okay. Wherever I come from, however I am, I know that I'm ready to now begin. All right, so now that we're all kind of centered, let us get started. Okay, so a little explanation as to my topic choice. I completed my pre-practicum virtually, as I mentioned before, and this, I believe, affected my music therapy journey in several ways. I know for a fact that I missed out on an entire semester's worth of in-person experience working with clients. This semester, when I went to start my practicum, it was just strange being in the same room as not only my supervisor, but the clients as well. It was a whole new ballgame. And my supervisor right now is actually just having me not take notes during sessions and just kind of sit and be in the moment and get adjusted to being in the music therapy setting, because that's an entirely new thing. I also had to work harder to form initial connections and rapport, because it's one thing to be sitting next to somebody or sitting across from somebody and being able to kind of feel their energy and how they're feeling. And it's another thing to be on a screen and one person can be making his face, might be muted, might be wearing a mask even. I know my clients, they were just in a day room. So not only was I on screen with them over the computer, but they were also wearing masks and they were muted some of the time. So it was very difficult to kind of navigate that. I know that it limited my ability to observe, assess, and interact with clients. We got significantly fewer clinical hours. I know in the past, classes had gone in person and they had some travel time, they had some kind of hang around time to speak with the supervisors, the staff, the clients before and after the sessions. But for us, it was just kind of we log on. I was actually on FaceTime. We used FaceTime for mine instead of Zoom. And so we log on to FaceTime, we do the 15, maybe 30-minute session, and then we just close it and that would be it. And then the other thing is technological difficulties played a huge part in that. I know there were some times where I had half a session with a client because we got going and they would freeze. And yeah, so long story short, I was thinking about all that, and now that I'm entering my practicum, and I was like, I wonder how much more prepared or how differently I would be prepared for practicum had I had a typical pre-practicum experience. And I got to thinking how this affected other people. I had roommates that were and friends that were in their practicum and internship and even graduated in the field, and they were facing these same challenges. And so I was like, I'm going to look into that. So that's long story short. This presentation I put together combines research that I've done with kind of anecdotal research that I've done. I created this Google form questionnaire and I sent it out to a good handful of people, students, alumni, professionals in the area. And my advisor, Dr. Lisa Summer, was awesome and helped distribute that as well. So I have some different perspectives. It's all anonymous. I'm not quite sure who said what, but some different takes in there. So that's that. So the purpose of this presentation is to provide insight as to how COVID-19 has affected music therapy on all levels, ranging from undergraduate students' experiences in pre-practicum to the structure of sessions and interventions and how they've changed for both emerging and existing professionals. So by the end of the session, attendees would be able to understand and identify specific ways the music therapy field has adapted to the circumstances of COVID-19, gain insight as to how we can better prepare ourselves for the field while taking into account new changes and developments, and also learn about how music therapy can actually benefit COVID-19 positive clients as well, whether that's clients that you have and then they contract COVID, or just clients that you're brought in to work with because they have COVID. Some trends in COVID and telehealth. So when we think COVID, I'm sure all of us are like immediately Zoom. Telehealth, first thing that we think of, especially within the healthcare field. It's kind of a strange idea that you can just kind of video chat your doctor. Strange to me at least, but it's how it is. And so telehealth. Per the CDC, as of November 5th, 2021, I got the most recent data as of yesterday. I think it's the 6th. Anyways, there are approximately 1,365 new positive COVID cases each day, 13 deaths per day related to COVID. with 19,087 deaths to date and a total of 861,480 total positive cases. That's a lot of COVID. Geographically, the utilization of telehealth sessions varies in frequency between regions. So basically, as we're going to see in a moment, different areas of the country have different trends with COVID, and they also have different trends and patterns in using Zoom. So it's a lot of diversity among just the US. And weekly telehealth visits decreased when COVID-19 cases declined when COVID-19 cases were decreasing and plateaued as cases were increasing. So I know there was a period of time where we were kind of like, oh, like COVID's going away, but it's not really, just because the cases were decreasing and more visits are starting to be in person doesn't mean that it's not still a legitimate threat. So this is the chart that I was going to mention before. This has the average percentage of weekly telehealth visits and the average number of COVID-19 cases. So if you look here, the South is kind of all over the place with this number of cases. They're pretty consistently having the smallest amount of telehealth visits. And in contrast, the Northeast has actually way more telehealth visits than COVID-19 cases in comparison to the South. So it's kind of like two opposite ends of the spectrum here. As you can kind of see, the number of cases were rising a little bit. This is from June to November. So yeah, that's how that is. Something to note. I can't turn the page, hold on. Okay, so a statement from the AMTA. So the AMTA and a lot of LLCs and other music therapy groups released statements regarding the preservation of health and safety. As soon as COVID kind of hit, I'm sure everybody remembers, we saw this huge kind of transition from how things used to be on top of each other in line at the movie theater waiting to buy snacks, and now it's like everything's spaced out and everything everywhere is different. So music therapy individuals and groups and the AMTA all kind of had their own way of addressing everything. And so you can see that here in their statements. I kind of collected a few of them here. And for example, this one is from Roman Music Therapy Services. Oh, what did I do? I didn't mean to do that. How do I go back? Okay. Hold on. I don't know what just happened. Give me one moment, please. Okay. Like I said, I'm not an Apple person, so we're making the most of it. So these are the statements, and Roman in particular released one saying, "We stand united with our community and ready to stay engaged while we're all dealing with the changes in our community related to COVID-19. We will keep this page updated with information from our team, important paperwork and notices of virtual music therapy services and online resources." So a lot of changes with that. Adapting protocol and other safety considerations. So one of the questions within the Google form that I shared was how people have observed changes within their sites or just changes within, if they were in their practicum, like how they observe the music therapy setting changing with the new safety things to consider. So a few things are that a lot of places are mandatorily requiring masks for everybody, not only the therapist, but also for the client, for the parent, guardian, etc. A lot of COVID checks, screening for clients, an updated policy for disinfecting and sanitizing of toys and instruments, which is huge. I remember seeing something as like a side note talking about how in the past we went bowling, and it's like we all stuck our hands in the bowling balls, and it's just crazy how much dirt is there. And now that we're more aware of it, I feel like personally I'm constantly disinfecting everything, not just the toys and instruments for sessions. The complete transition to telehealth services in some situations. Also adjusting the sick and cancellation policies to be more flexible. Before it, even now sometimes, but it was almost like it was pulling teeth to kind of get sick days here and there. But now for the most part, places are like, have you had a cough? Do you feel sick? Have you felt sick in the past 48 hours or anything like that? And now they actually encourage you to not attend things if you're feeling sick, which is a change as well. So this right here is a video that I found that I'm not sure how to share my sound, but I would like to share it. Can you guys hear this? Hello to Farah. Okay. Hi, Farah.
The reason for this programming is really to promote a sense of normalcy, for one. So these are things, music groups might be something that kids would be doing at home on their day-to-day activities, but then also to promote socialization. So during COVID, which is naturally isolating, right, of itself, I really want to use this experience over the CCTV, this programming, to provide that group dynamic or that feel of a group. You're happy and you know it, play the bell. The second piece is to promote resiliency. Research shows that actively engaging in music can improve their mood, can help decrease anxiety, can help strengthen their social skills with others. So typically in a live group where I have all the kids in front of me, I can feed off of what they're doing. I can't do that over CCTV. So I just ask the question and pretend that I hear an answer back. Michaela, hi. So far, it's been really well received. And I think it just gives patients something that's different during their day and also promotes all of those skills I'm looking for to enhance their mood and to promote that socialization, even if it's over a screen. Awesome, nice job, everybody.
Okay, was everybody able to hear that okay? All right, I'm gonna take that as a yes. So, oh my gosh, I keep doing that. Hold on one moment. Okay. All right, so that video that we just saw is a video of CCTV, which is closed circuit television. In this situation, this is being used at American Family Children's Hospital in Madison, Wisconsin by the music therapist Carly Ramthun. And essentially, they're doing their music therapy sessions there, what would typically be, I believe, group sessions, but it could also honestly be individual if it came down to it. They're doing it over a closed circuit television. So basically the only people that can access that music therapy session are the clients and people within the hospital that are given the access to it. Almost like when you post something on YouTube and you just have you need the link or you need permission to access kind of deal. So I thought this was a really interesting and really unique kind of convenient way. I hadn't thought about this when I was thinking about telehealth services. I'm sure it's challenging because, like she mentioned in the video, she can't hear the clients, she can't really see the clients interacting, and it's almost like a television show in some ways. But if you go about it the right way, I'm sure that the client can experience some interaction, experience some benefits from that. So Carly said, unfortunately, due to COVID-19, we are not able to have these direct group social interactions, but we have come up with some temporary solutions to meet the needs of our patients. She also explained that she drops off the instruments to the clients ahead of time to their rooms. And when she does lead individual in-person sessions, she has to be suited up in all of her PPE, especially depending on the client's diagnoses and everything. So I actually have a few discussion questions throughout here. I believe at least two, perhaps three. My first one is, what might be some benefits of CCTV music therapy and what might be some complications? So if anybody feels interested in speaking up, I would love for this to be kind of an open dialogue. I want to hear your thoughts too, because we're all experiencing this together. I'm no expert on this topic just because I chose to make a PowerPoint about it. So what are some things that you guys feel like, would it work for you in your placements? Have you experienced this? Just feel free to unmute yourself if you'd like to participate.
I personally have not. Yeah, because like me, I know Katie and I also did the same practicum when we were juniors. So Katie, if you want to like touch upon that more, feel free.
Yeah, sure. I know our supervisor, Keisha, did something like this where she would post videos on YouTube or on like a Facebook and go live, and the clients could interact via that. So I think that's kind of similar. Um, and I think the clients could really benefit from it. Like you said, there's like just that interaction and being able to like comment on the live stream and like interact via like the comment section. I know it's kind of crazy, but I think that's kind of a benefit that we have when we're doing live streams instead of like in person, because it still gives that like social aspect to it.
Yeah, those are awesome points. Thank you so much for sharing and for bringing that up. I didn't even think about that. That's so true. I see so many different interactions, and I feel like I hear so many crazy stories about people connecting in the comment section of different videos and things like that. And I think in addition to something about this is if they have the, depending on like the specific hospital and if they have the rights or not, it could also be replayed and kind of rewatched and redone as opposed to a live session, which is kind of like a one and done unless you're recording it. So yeah, I appreciate the input. Great. So the AMTA competencies. So I know this was on my mind, especially when I found out that I was only getting like less than 30 actual hours with clients for pre-prac and everything like that, and not being able to be in person. So I was like, I wonder if I'm going to be ever caught up in hours, if I'm going to be prepared for when I eventually take the boards after I graduate. Because the pandemic has interfered with the music therapist's ability to meet several AMTA competency standards. They're clearly still possible because there's still music therapy happening, but it does make it more difficult. So we can take a look at how exactly competencies are affected. So again, I'm still kind of moving this bar around because I'm not quite sure what to do with it. So the competency 9.2 is establish and maintain interpersonal relationships with clients and team members that are appropriate and conducive to therapy. So I believe that this will likely have been made harder by the pandemic because forming natural supportive relationships with both your clients and your coworkers can become complicated with barriers such as telehealth. You know, you only have on Zoom or FaceTime in my case, you only see a box of a person. And so if you're trying to assess the client for anxiety or whatever, sure, there's other things you can pick up on, but if they're not presenting from shoulders up as being anxious or being upset or anything, you can't tell if they're bouncing their leg necessarily. You don't know what they're doing like outside of that little box. And in addition, especially if they're on mute or if they're wearing a mask, there's so many factors that you could potentially miss. Also technology issues, like I mentioned before, it's hard to really form a relationship with somebody. I know, for example, one time I was in the middle of talking to one of my clients because for my pre-practicum, we worked with elderly clients with dementia. And I was speaking with this one lady and the Zoom kind of lagged and cut out, and we weren't able to really get back into the conversation like we were initially. So that definitely made things more difficult. Also, social distancing. Let's say you aren't even on telehealth, you aren't even on Zoom, and you're just socially distancing. I know that my music therapy professor has one client that she's talked to us about, and she does some motion interventions with him and some motor interventions with him. And there's times where she kind of helps him stretch out his legs. And with social distancing, if you have to be apart from that client, you're not necessarily able to do the same things that you used to do with them. You have to kind of keep that physical distance, not even necessarily a pat on the shoulder, like a tap on the hand in some cases, depending on how vulnerable that client is to picking up diseases, and how vulnerable you are as a professional. And masks make it hard to not only pick up on facial expressions, sometimes speaking is difficult, understanding what people are saying, things get muffled all the time. And yes, so Another AMTA competency, which would be made more difficult due to COVID, is selecting and creating music therapy experiences that meet the client's objectives. Now, again, obviously music therapy still goes on, but it is a little bit more difficult having to take into account all these new factors that weren't necessarily in place a couple years ago. Your choices become more limited due to many of the same factors, it's supposed to say factors mentioned previously. If the client is virtual, any interventions which include instruments are often off the table unless the client has them at home. But for the most part, if you're doing a group session online, you can't really pull out your bin of instruments and be like, we're going to do an instrument jam. It's kind of really a case-by-case situation and seeing what the group has available and everything like that. In the telehealth sessions, the client's environment, as well as who else is present with them, may affect their level of participation. So we have to take into account the client's home life, who the client lives with, who they're comfortable with. You know, is mom or dad kind of overbearing? Are they going to make the client feel uncomfortable or kind of not kind of dictate what they say or encourage them to say or think or feel a certain way? I'm sure we've all kind of had interactions with children or even young adults where they are perfectly capable of handling themselves on their own and speaking up for themselves, but either when mom or dad comes around and the parent kind of steps in for them or is like, oh no, say this, do this, whatever. Sometimes you can't really necessarily get the client's authentic self if they're around other people, like you would if you were just in a room with the client and whoever else is in the group as a therapist in a in-person session. So there's that. Also, you never know if there's, you know, siblings running, screaming in the background, whatever else is going on. Or like a TV, other distracting factors, things like that. So definitely there can be some benefits if, you know, clients running late, might be easier to set up from home sometimes, but there's also a lot to think about in that sense as well. And then competency 13.3, provide verbal and nonverbal directions and cues necessary for successful client participation. So cueing the client and providing musical prompts becomes increasingly challenging when technology and the internet fails and the audio or video of the telehealth session becomes distorted, choppy, or delayed. I know I keep repeating this, but this truly is a huge factor. I know the Wi-Fi at my college isn't exactly ideal. And so already it was difficult to make it work. And I mean, that goes for the Wi-Fi anywhere. It's kind of a delay, even if the Wi-Fi is working perfectly, there's still kind of some sound delay, and you can't really cue and prompt a client like you might if they're right in front of you. The client might also have a difficult time understanding these prompts or being receptive to them without the therapist physically being near them to feed off of. So there's just something about sitting next to somebody and being able to feel their energy and being able to lean into the music. And if it's just coming from a speaker on your computer, it might not have that same effect. It might be difficult to comprehend. And once again, there might be factors in either your environment or the client's environment, which are distracting and take away from the quality of the session. So here's a little bit of related research. So here is one very large case that I found. And so basically Dr. Wendy McGee, along with several other professionals, created this case study on implementing music therapy through telehealth considerations for military populations. And within this, they looked at 3 specific case studies, and we can talk a little bit about each of them because they all have their own unique purposes. But basically they took these 3 different populations and they did telehealth with them, and they were kind of analyzing, does telehealth even have an effect? Is it worth doing the telehealth sessions if it's not going to have an effect? And so the first case study that they looked at was this program called Music Heals. And so they basically took the liberated child soldiers of an army in I believe it's Uganda, and a class in Berkeley actually worked with them in telehealth sessions, which is so cool working across the globe doing music therapy, just from your own classroom, and working to kind of give them a voice and all of that good stuff. One thing that was notable is that there are 1.3 million people per psychiatrist in Uganda. And so that number absolutely blew my mind, and it clearly blew Dr. McGee's mind and everybody else involved in creating this program together, because the students at Berkeley, as you'll see in the results, clearly did a fantastic job of addressing that need and giving them kind of empowerment and a voice and some services to help them, because mental health is so important, and it's clearly very difficult to get help in some situations. So another case study is Semper Sound Cyber Health Program, and that is about a veteran who was kind of in and out of services, different treatments, constantly starting and ending relationships with a different music therapist. And so he was like, you know what, I'll do it virtually if I can keep the same one, like kind of tested the waters out on just having one online therapist instead of having to stop and start a bunch of therapeutic relationships, which is really interesting as well. And then the third one was about just this group who kind of worked with this one soldier, this one veteran, giving him telehealth sessions, music therapy sessions, and it worked so well that they ended up kind of expanding it and going onward with that. So in all of these situations, music therapy, telehealth actually did have the capacity to achieve goals and make progress with the clients, even though it might have been hard to navigate because they're not in person. So in conclusion, the clients reported a decrease in pain, anxiety, and depression. They endorsed that telehealth is not a deterrent to continued music engagement. They actually requested continued music therapy telehealth sessions and recommended it to their peers. So music therapy for COVID positive patients. Now, whether that's your patients that you already have who, just tested positive for COVID, probably gonna end up taking a couple weeks off to recover, but also for COVID patients, music therapy has helped them. So a man named Filippo Giordano, I believe that's how you pronounce it, he conducted trials in which he examined the effects of music therapy on the emotional well-being of frontline workers. He found that they showed decreased levels of tiredness, sadness, fear, and anxiety when they experienced music therapy sessions. So this kind of trial was so successful that he began actually studying the impact of music therapy services on these frontline workers' patients as well in intensive care. And so far, I believe it's still ongoing. He's seeing very encouraging similar results, that music therapy is actually relieving some of the emotional effects of COVID-19. Well, it's probably not going to get rid of your cough. It can help you definitely get through it mentally and emotionally. And he says that by focusing on positive sounds and imagery, the sessions allowed patients to go away from the intensive care unit emotionally and to be in another place, which is super important for healing from that. And also, one thing that I thought was really cool, a man named Tom Schweitzer, certified music therapist based in Loudoun County, he contracted COVID himself. And so he's like, well, what else do I have to do for the next 2 weeks? So he created a free music therapy support group on Zoom for other COVID-19 survivors and who are still struggling with lingering effects. And it's actually going on to this day. They meet for an hour a week on Zoom, and they do breathing exercises, movement, they listen and do receptive music therapy, and they all kind of sing along. So it's just kind of a huge morale booster, just kind of a connection thing. A really great way to socialize when you are in isolation. Ooh, okay. I didn't even know I put that transition in there. Cool. So I have a discussion question. So after we've talked about all these different ways that COVID has changed the music therapy field so far, how do you all predict that it will do you think it will stay consistent going forward? Do you think it'll continue to change? In what direction will it change? I would love to hear from you, especially those of you who might have just come in. I would love to kind of open it up and hear your perspectives as well. So if anybody feels like unmuting, I would love to hear from you.
I can say with my experience within practicum, you know, with COVID, it definitely was not easy, but I feel like because now that we've gone through a whole year of this and, you know, at first it's like, okay, what do we do now? But in terms from like within like Katie's and I's practicum, we had a lot of like music tech opportunities to like incorporate within like telehealth or like, you know, with social distancing, like, you know, trying to find alternatives. It was difficult trying to think of like interventions, like what do we do? But there's a lot of like, at least within telehealth, there was a lot of opportunities. So like we would do stuff with like GarageBand, creating like heartbeat recordings, and something like that. It was just so like powerful and just meaningful that, you know, I think moving forward, we can work around how COVID is going to affect music therapy on like going forward from now. And it's possible. So yeah.
Awesome. Thank you so much for sharing.
I definitely agree with Toby. I think going forward, it, like, although COVID has been really
We're losing you.
as music therapists who normally can't leave their homes. So we still have telehealth sessions for clients who might not be able to leave their. So I just think it benefits us in so many different ways as well as clients, and we can still use telehealth even after COVID if it would benefit the client.
Yeah, thank you so much for that. You cut out a little bit, but I think I get the gist of what you were saying. Were you talking about how going forward, even once we're back to in-person sessions, we can still utilize telehealth, especially for clients who can't leave their homes or who can't otherwise come in to the actual session?
Yeah, I'm just talking about how, like, if a client is immunocompromised, even outside of COVID, they can still benefit from the telehealth.
That's a great point. Thank you so much for bringing that up.
I can share as well. I think that music therapy is a part of the big picture of life, and COVID influenced for all life that we began more open for telehealth and another tele contacts. At the same time, people miss a lot live contact. So I think that both lines of music therapy will develop, and people will ask the live contact, in-person contact, and it became even more valuable. But at the same time, I think that many people opened for themselves that they have a lot of another opportunities connected with Zoom, connected with internet format. So I think in this way, some forms and some, I don't know, discoveries, not only in music therapy, but in our cultural behaviors, they will come into vocabulary of music therapy, vocabulary of tools, vocabulary of different methodics.
Thank you so much. Yeah, I agree. I think that both the telehealth and the live music, they're both so important, have their own functions. And I really hope that going forward, we can kind of find a way to utilize the good parts about the telehealth, but also kind of get back into, like you said, the live music and really interacting. And hopefully we could just kind of make the entire field of music therapy more broad and more accessible for everybody. Does anybody else have anything they'd like to add? Okay. So I think we're just about almost done. We're just about almost done. Okay, so within the questionnaire that I distributed, I asked a lot of questions and kind of used that to kind of guide my research. So I know I haven't really referred to it a ton throughout the presentation, but I really appreciated everybody's responses, and they helped me kind of shape what I was looking at here, took everybody's ideas into account. And so some of the responses to this question I thought were really notable. So a few common predictions throughout all the responses that I got are that telehealth services will continue to be a part of the music therapy field going forward. I agree, kind of like Svetlana was saying, I don't necessarily see them going away anytime soon, but kind of learning to come together with the live music in-person sessions to really benefit as many clients as we can. One person brought up that the intake of clients with mental health related needs will probably increase, and therefore there will likely be an increase in the amount of music therapists specializing in mental health, or the demand for music therapists specializing in mental health. Rates of social anxiety will increase probably among everybody, because just we haven't been around people in so long. You're getting back into that, and I can definitely foresee that being prominent within the session. And physical illnesses will be taken more seriously by society. I certainly hope so. I think that learning to prioritize your well-being mentally, physically, and emotionally is super important. And it's unfortunate that they haven't been taken seriously until now. And I hope that people will continue to discourage people from coming into work when they feel sick, and it's not like not considered like a slack off thing to take a mental health day or a physical health day. We will be more aware of our overall cleanliness, not only when working as an MT, but also in our everyday lives. Kind of like I said, I still can't believe that we ever went bowling, but especially when like working with different instruments and toys and manipulatives during sessions, making sure they're clean, making sure your instruments are clean, everything like that. So, and then music therapists will work to make their services more accessible. So here are my sources, and yep, just a thank you to everybody who was able to help me out with my presentation, everybody who participated in the Google form. And if anybody is interested in seeing the results and the answers of the Google form, I didn't go into super detail about them here because again, they really just helped me to shape my research. But I am able to provide those as well because they are anonymous. So thank you. Does anybody have any questions?
You know, Adri, I have to say, I really thought your presentation was just like, it was amazing to see how much like you put so much effort into this, and like including within your own experience too in providing this research. It's going to definitely aid well into, you know, more music therapy research, because, you know, this is not going away anytime soon. And you know, I think it's going to really help a lot of music therapy students and professionals think about, like, you know, if there's another matter like this in the future, like how best are we going to handle that? And now that we have like data such as yours and more that are coming forward, it's going to aid so well within just the profession. So amazing, splendid job on your presentation.
Thank you.
I'd also like to say that you did great. I did learn a lot, even though I came in a little bit later in your presentation. I did find it very interesting how you were saying that the mental health bill will continue to grow in telehealth services, because I recognize that myself. I had to start doing that because of COVID. I had to start seeing my own therapist over like Zoom every week. And at first it was very frustrating, but then it became more and more comfortable because I was able to stay in the comfort of my own home. I didn't have to travel anywhere. The session could last a whole hour because it was easy to get in and out of the session. And the implications that what it can do for music therapy in particular, I think will be very effective in the long run. And that we'll continue doing it even after, if ever after COVID.
Thank you so much. I appreciate that. That's a really good point. Just about the session times and how you can feel more comfortable going into this session if you are in your own home. That's a really, really neat perspective. Thank you so much, Seth.
I would just like to say, for the amount of presentation that I've seen, Adri, that this was amazing. The research that you did to support how COVID actually does affect music therapists and the students and the professionals and the field just in general. I think it's kind of ironic how like we're doing passages online. So your presentation is an example of itself, an effect of COVID, which is really fun. So it's already like, you know, research is already backed up by the current moment. I know that we've discussed about how like this is possibly something that you could even look further into, like if you know, plan on doing like a thesis or whatnot. So I'm really excited for you, and I'm really excited how this all came about. Thank you for presenting.
Thank you so much. I appreciate that. You're so right. This is just like, I mean, if you need proof, I guess the proof is in the pudding, the proof is in the presentation. So yeah, thanks, Emily.
I want to say just thanks, because I didn't expect that it will be so broad and so many facets will be touched. And I want to say that yesterday I participated in micro session of Emily, and of course telesessions have their specifics, but they can work, and our work, the work of music therapists, people need it, so we'll do it. Thank you.
Thank you so much. Thank you. I appreciate that. I'm so glad.
I just want to like, well, let me turn on my video. Hi. I just want to highlight like just how important this research is. I know for me personally, last year, my internship was completely remote with kids with developmental disabilities. And oftentimes their parents would mute them. And I had a client who wore headphones in the session. So it was like impossible to get any help when I needed it. And then transitioning into this year, I'm in a partial hospitalization program for young adults in person. And I'm like, I don't know how to do music therapy. Because like I learned how to do it on Zoom with a totally different population. And I work with that population. And so like the act of moving into a new population and also moving in person is really challenging. And I don't think that like it's being addressed, but not to the extent that it needs to be, especially for people who've done a whole year on Zoom and then are being pushed into in person. And especially the people that just graduated and did their internships over Zoom and now have to be professionals in person. It's really challenging. And I really appreciate that you're doing this research and figuring out what are the best options for the field in this brand new time. Because I don't think Zoom, I don't think telehealth, I don't think any of this stuff is going to go away, but it's how to better manage it and like learn from what we're doing. And I think that what your presentation just really highlighted all the important research that needs to be done. So thank you.
Thank you so much. I really appreciate that. You're so right. I can definitely relate to the feeling of not knowing what I'm doing now that I'm in person with people. I'm like, oh, I just don't know how to exist other than a screen sometimes. So yeah, I feel like that's not a unique experience whatsoever. And that's why I feel like it's really important that we're just aware of how different this time is than any other time, especially for music therapy field in particular. So I appreciate it. Thank you so much for sharing.
Can I make some offer? I'm only beginner. I'm first year student, and my internships are in the future. But what Catherine said just now, I realized only now that, oh yeah, what we see as an examples of music therapy, all these were in person. And next autumn, next fall, my first internship should be, and if it will be again through internet, I really don't know what to do. So my offer is to organize something like workshop, and maybe Catherine, maybe you, Adri, maybe all who has this unique experience of making sessions through internet, maybe they would share with us the experience, because it's challenging. And if you could figure out, please share with us. We need it.
I appreciate it. Yeah, that's a really good idea. Definitely, I'm still working to figure it out myself, but if I find a secret, I will be sure to share it with you guys. So, thank you. That's a brilliant idea, actually.
And this is also my advice to everyone, and especially you, Adri. How you exist now is how you'll exist anywhere and everywhere. So exist how you would be within sessions, even though it is hard, because how we face things in life is also difficult compared to telehealth. Like, we'll always have technical difficulties, or, a client may not have like an instrument for an intervention that we want to pursue. But, after a year long of just, difficulties and going through so much, I think right now is a better way to now better prepare ourselves, and just making sure that, like, even though stuff does happen, just exist and continue to do better as much as possible.
Thank you. That was awesome, Toby.
But yeah, if anyone else has anything to say, you can feel free. But this is actually our last presentation for today and for passages. I wanted to say thank you so much to everyone that has came. I definitely want to thank Emily, Adri, Catherine, Maria, Taylor, and Bridget, and Sarah, everyone on the board for making this happen.
And Katie,
Without your, without your drive and just, the urge to make this happen, I would have not done this without you guys at all. So thank you so much. As for this presentation, Adri and everyone else that is present, I know that Bonnie is here, and Svetlana and Emily, but I will be sending you guys certificates of completion for presenting as passages, and it will be actually recorded. So right now we're on a Facebook Live, so that will be automatically saved to the timeline. So if anyone would like to look back on that, you can look us up on Facebook, NER-AMTAS. We're also on social media for Instagram, Twitter, and YouTube, so you can feel free to look up that way. But again, thank you so much for everyone that's came today. Without your participation and presence, music therapy wouldn't be as, as alive as it is without any of you and everyone in the world right now. So thank you.
Also, thank you so much for the NER-AMTAS president and president-elect for putting this together. Yeah, you guys worked so hard, and I just want to say shout out to an awesome passages, and I'm so proud of both of you.
yeah, nice job, Toby. This was awesome.
Oh, of course, but again, thank you for all the presenters. You guys did a lot of work for this, and this information is just out of this world. For that being, can you guys actually send me a copy of your presentation so we can just save it and share it with the public? We'll be posting that in our it's like a link tree on our Instagram, so that can be a source for people to look back on. For that matter, we do actually, before everyone goes, I'm going to have Catherine share a video that we showed yesterday, but if no one had the chance to, but it is a special video from Lee Kinvey that we wanted to share. Oh, and make sure to share your sound as well.
Oh, I was muted. I'm so sorry. I'm trying to stop the share and it won't do it.
Hold on.
Is there like a little red box next to where it says that you're
Oh,
sharing?
it was hiding. That's where it was. Okay. I'm so sorry. Here we go. No, I can't. Okay.
Hello, passages, and welcome to the 22nd Annual New England Region.
Oh, no. I'm so sorry. Okay, we're just going to watch it small.
Hello, passages, and welcome to the 22nd Annual New England Region Passages Conference. It occurs to me that when I started this conference, many of you were not born yet. So we really have been doing this for a whole generation now. And I just could not be happier that it's still alive, that it's still growing, and that you all are continuing to evolve the conference into what you need it to be. I hope we all keep growing and learning more about ourselves through our whole lifetimes. The more you understand about yourself, and the more authentically and wholeheartedly you can be in the world and with your clients, the better therapist you'll be and the happier you'll be. So I'll lead by example here. In the last couple of years, I have realized that my gender is way more non-binary than anything else. And so I have changed my first name to Lee. It's just L-I, and I'm using they, them pronouns now. I hope each of you can lead with open-hearted curiosity today. I hope each of you, as you're attending sessions of your peers, can think of a question that really interests you in the session, a question that comes out of your curiosity, and then offer it to the presenter as a gift. Because a good, open-hearted question that really comes out of what someone said, what they offered, that's a gift. So see if you can give a couple of gifts today. Thank you to the organizers, thank you to the presenters, and thank you to everyone attending sessions. I hope you have a wonderful Passages Conference.
All right, since that is everything, we're going to end this meeting at 4:01 p.m. Again, thank you for coming to Passages. This will be posted later on in the weekend. And yeah, that's the end of that. Thank you so much.
Thank you, guys. Thank you, organizers. Thank you.